You have to take history from 13-year-old girl, Nadia, who is a known case
Okay.
of Thalmager and
Okay.
came with her mother, Alia.
अरे यार, अरे सुनो संदीप यार, थैल मेजर क्यों दे रहा है वो? उस टाइम पे
कौन सा
हो गया
चाहिए
था
फिर?
शायद।
5-year-old boy, Ahmad,
हम्म।
referred to you to see OPD with episodes of loss of consciousness. He developed these episodes over preceding 4 months and has been in local emergency department after one episode of loss of consciousness. Okay, ECG, RBS, urea electrolyte were done, were normal at that time. Take a focus history from mother.
ओके।
Okay, uh, so take 3-4
ओके।
minutes. Anything else you want to know more than this?
नाम बता दो सिर्फ दोनों का।
Ahmad, and mother's name is Alia. चलेगा चेंज करने टॉपिक?
नहीं चलेगा चलेगा। मॉर्निंग।
Good morning, doctor.
I am Dr. Hiren, one of the children doctor. I believe I am talking to Alia Ahmad, the mother.
Yes, doctor, I am.
Thanks for coming, Alia, today. Today I'm here to ask you some of the questions regarding Ahmad's health concern.
Mm-hmm.
And if you don't mind, I will take a few notes of it.
No, doctor, thank you.
So I have received a letter like Ahmad had episode of
Mm-hmm.
passing out 4 months back, and recently also it has happened and has been brought to the emergency. So could you tell me in more detail about this? What exactly happened
Actually,
to
doctor,
him?
till 4 months before, he was quite okay.
Okay.
And like suddenly in one day, like while he was doing the exercise or during morning PT round, PT class, so teacher told that he suddenly fell down. And during that time, like was not able to, like he was not able to speak, and literally he was loose, as teacher said to me. And they did some, like they splashed some water on his face, and he was okay after that. So after maybe after 1 minute he came back to normal.
So it lasted for 1 minute.
Yeah, the teacher said like 1 to 2 minutes it lasted first time when it
And
happened.
did teacher tell like was there any kind of uprolling of the both the eyes, any secretion from the mouth,
Yeah,
any
actually,
movement?
they did not notice in that particular, but like it happened so suddenly that they could not notice that uprolling of eye. But like there was some drooling, like some saliva had come from the mouth.
And after that, Ahmed was completely all right, or he was sleepy or unoriented.
Like after that, the teacher said like he was like for 10-15 minutes little bit uh, drowsy, or like he was not in complete senses.
Okay. And when this episode happened, was there any um, pee or poo
Yes,
in
yes,
his
doctor. I
pants?
forgot to tell you that they said that there was like he peed in his pants that time.
Okay, okay. And did you ask Ahmad before
Mm.
he experienced this episode?
Mm-hmm.
Uh, was there any kind of funny sensation, or
Mm-hmm.
was there any kind of blurring of vision
Mm-hmm.
before this episode happened?
Doctor, like that episode he does not remember, but it happened once again when he was at home, and it happened suddenly. He was not exercising also that time. Like that time he said like he was feeling some like some blackish spots in front of his eyes, and suddenly he fell down and there was some I noticed that there was some jerky movements of the body.
Mm-hmm. Okay. So the first time when when he experienced this, at that time, he was doing exercise in the school?
Actually, like that was the routine morning PT class was going on that time.
Okay. And the second time you said that he was just quietly
Yeah,
sitting
just he was in
at
the
home.
house and while playing, suddenly he said like I'm feeling something like, and suddenly he fell down and there was a jerking, peeing in the pants, and he had some
And
drooling also.
that episode lasted for how many minutes?
Yeah, that also I guess around 2 to 4 minutes, 2 to 3 minutes. I don't remember, but it was not very long also. And after that, again he was drowsy for a few minutes.
Okay. And after that, was he completely normal?
Yeah, and then when once he become up and started playing after 1 hour, he was okay.
Okay. All right. And totally this happened total two times, or
Like
was there
total
any more
four
episode?
episode happened up till now. Like
Mm-hmm.
second, third episode happened at home, and like I was there one time. My husband was there. First episode we did not witness, but other episodes were similar, which I just described to you.
Okay. And did you took him to any brain doctor? Did you make any test on him after this?
Actually, doctor, we did not go to any brain doctor, but after second episode, like we went to GP, and that time we told him that he was exercising in the school. So he said like this can be a syncope, like the things. So he did that time ECG and some blood tests were done and were absolutely normal. And he reassured us that this could be a normal phenomenon, maybe because of heat or maybe because of exercise. So, like initially he was worried about some cardiac issue, but like he was okay. ECG was normal. Then he reassured and sent us home. In last 2 months, again 3 episodes happened.
Mm.
Initially, one, 2 episode we neglected because GP reassured us that there is no problem. Like now, again it happened last week. So we went. So he said like there could be some problem in his brain that made us scary, and we came here to show you for further
Right,
opinion.
right. Currently, is he on any medicine?
Like he GP had given in some calcium and multivitamins at that time, but
Mhm.
no other medications were given.
Okay. And uh, has he had any trauma in the past? Any
Mm,
accident? Anything?
like kids keep on falling here and there, but nothing's something sort of serious, doctor.
Was there any hospitalization for any problem?
No, doctor, there are nothing, no major things happened.
Was he born at a full term? Was when he born everything was normal with him?
As far as I remember, everything went fine during pregnancy also, and after birth also, everything was okay.
Okay. And what about his growth? Did he start walking at the age of 1 year and speaking at the age of 1.5 to 2 year?
Yeah, I feel like he was quite okay. Like he has an elder sister, so like as compared to her, he was quite fine. Not like delayed or something. We feel.
So as per the other children, he achieved this walking as well as speaking on the right
Yes,
appropriate time.
yes, doctor.
Okay. And does anybody else in the family has a similar problem?
Doctor, my elder daughter, like she is diagnosed a case of seizure, like when she was 7 years old, and she is taking some tablet called Valparin, I guess. So the last 1 year she's taking a tablet.
Okay, I see.
So like
Mhm.
we are also
She's
worried,
okay.
like he also has the same problem or what?
Sh- Is she okay now?
Yeah, she's controlled. She's taking tablets regularly.
Okay. And you also okay? And
Yeah, apart from that, there's no family problem. 9 minutes, huh?
okay, okay, okay. Um, how about the school? Are you putting him on day cares, any day school?
Yeah, he goes for this KG1, like, and he's
Okay,
doing fine in the school.
okay. Does he have any fever?
When doctor, right now he doesn't have fever.
And when episode happened first time, has he had a fever?
No, doctor.
Okay, okay. And any problem with his vision?
No, no, he was okay. Okay.
Any problem with the hearing?
No, doctor.
Any issue with the like racing of heart and excessive sweating?
Like he's small, doctor. He's not complained like that, but I don't feel like he has any issue like that.
Mhm, okay, okay. Apart from this, any problem with the pee or any problem with the poo?
He had some constipation off and on, but otherwise,
Okay,
okay.
okay. Any skin rash?
He had some like black spots over his body, but no, otherwise okay.
And all the episode which you have observed so far, it's like the same kind of a duration. And was there any particular movement like fisting of the hand or uh, bending of the both legs? Have you noticed like that?
So what I noticed, doctor, it is like jerky movements of the body. Jerky means like
Whole
you
body
can say
or
a little bit
only particular?
jerking, like shaking.
Mm-hmm.
That shaking lasted for a minute, then like he becomes loose, and then it stops.
Mm-hmm. Okay. And how is he coping with this since 4 months? This is on and off. It is has so far 4 episodes. So how is he coping with this condition?
Well, there is no memory for him such episodes, no. Like after that, he is okay, so he doesn't feel anything regarding
And
this.
how you as a mother coping up with this problem?
No, we have lots of stress, doctor, because this is like not a normal thing. Elder child also has some issues. This child also has issues. Like I feel that he might have the same episode. We are stressed, doctor.
Okay. And when you were pregnant, all of your scans, everything was normal.
Yes, doctor, everything was okay.
And what about his dad? Ahmed dad is fine.
Yes, doctor, he's
Any
fine.
financial support do you have?
No, as of now, not required. But maybe if we get some like costly investigation, that time we may need. But
Okay.
important thing, like I would like to tell that we are related, doctor.
Mm-hmm. Okay. So are you from the first like
Like we can second cousin.
family, the second cousin? Okay. Alright, okay. Any change in the weight in this past 4 months?
No, no, doctor. He's eating
Appetite.
well, playing around. That's fine.
Okay. And did he receive all jabs?
Yes, doctor. He received all his jab on time. He's due for his 5 year dose.
And did you notice in this 4 month any any like his skills what he achieved is like regressing means you feel that his mental performance and his ability in the milestone what he achieved is going back.
No, he's just 5 years, no? Like teacher did not complain like that anything, and I also don't feel anything. So that sort of 14 minutes
Okay,
isn't it?
fine. So I took a history of a 5-year-old child, Ahmad,
Mhm.
who presented to NE with the complaint of the a seizure. Total 4 episode he has experienced in past 4 months, and the seizure uh, lasts for few minutes with a jerky moment, and after that, couple of time he wet the pant also, and um, there was no particular history regarding the aura as the child is a small, and the the mother and the father both the second degree cousin, and in the family the other sibling also has the seizure, and she's on Valparin but under control. And apart from that, there is normal developmental milestone as per the peer age group, and no significant neonatal history, no history of past hospitalization or any trauma or accident, and there is no any financial concern. And baseline investigation like ECG and calcium and the sugars were done was found normal with the GP.
So, doctor, what is your impression?
Yeah, so since there is a uh, family history of the second degree cousin, as well as there is a family history of the seizure in other sibling, potential uh, diagnosis I would like to consider like epilepsy, which needs uh, further investigation like neuroimaging or EEG.
Okay.
Second thing, it could be some metabolic problem which
Mm-hmm.
present later on, but at the moment uh,
Mm-hmm.
I could not think of any particular condition.
Okay. So, what is the difference between seizure and epilepsy?
Um, Seizure is one of the component of the epilepsy. I don't know exactly the full
Okay.
definition of the epilepsy, but
So,
seizure happens in epilepsy, and
okay. So, like, how will you go about this investigating this child?
yeah. So this child, I would like to first, as he's already admitted, he's in A&E, I would like to uh, do the full
EEG
neurological
and OPD basis.
examination. OPD basis. Okay. So I would like to uh, do the full neurological examination,
Mm-hmm.
and also I would like to do the cardiovascular examination also,
Mm-hmm.
and like to consider some investigation which includes EEG and neuroimaging like
Mm-hmm.
MRI. I would like to do this investigation after discussing with consultant,
Mm-hmm.
and I would like to
So,
have a
like,
more
if the child is
video
developmentally
recording.
normal, no developmental concerns, so still you would like to do MRI or only EEG is sufficient?
First, I would prefer to do EEG,
Mm-hmm.
and if it is not conclusive or
Mm-hmm.
there is no clear-cut diagnosis in the EEG, then even though the development is normal,
Okay.
I would like to go for
Mm-hmm.
neuroimaging like MRI. Yes.
Okay. Okay. So, like mother mentioned, the child had some black spots on his body. So, like, if is any metabolic disorder which you could think of which can come with seizure at this age? If the child has some developmental delay.
Okay. If there is a developmental delay and yeah, there is a condition called tuberous sclerosis,
Yes, absolutely right. So, like,
which
uh, apart from this, like black spots, what are other features you see in tuberous sclerosis?
in tuberous sclerosis, like first is cafe au lait, the sport. After that, there can be uh, there can be like besides the nail, there is a particular skin lesion called fibroma. Uh, there can be uh, ash leaf
Mm-hmm.
spot, which is slightly different color pigmentation on the skin. There, once the child is little bit more older, there can be pimples like skin lesion, which is called adenoma sebaceum on the face. And apart from um, in the kidney also there can be cyst, which is called angiomyolipoma,
Okay.
and in
Okay.
the
If the,
heart also like
yes,
cryptomyoma.
yes. See, if this age is normal, so what would you do further? Age
Then
is
MRI.
normal.
If EEG and MRI both are normal,
Mm-hmm.
still there can be large number of the cases, the possibilities of idiopathic epilepsy also could be the possibility, in
Mm-hmm.
which there can be both things are normal and
Mm-hmm.
still the child can have a epilepsy or
Okay.
the seizure.
So, would you treat or would you not?
Yeah, I would like to take opinion of the neurologist here
Mm-hmm. Good.
after discussing with my consultant. But if it is a frequent episode of fits,
Mm-hmm.
I think it needs treatment. Yes.
Okay. So, what counseling you will do about parents? Like, what advice would you like to do to these parents of this epilepsy child? General
Yeah,
advice.
I would like to advise parents like, there has to be some whenever like he goes for shower, the rooms should be the doors should be kept open, should not be locked. Whenever this seizure happens, first thing you have to put the child in a semi-recovery position and also have to keep any kind of the object which can injure physically should be kept away, and also how to take care of the airways, and uh, also I would advise them to minimize any triggers like strong light, as well as the lot of noise or the television, prolonged television watching, all these things, the trigger, I would advise to keep it minimized, and would give them like instruction to take the medicine regularly.
Okay.
Yeah.
Okay. Okay. It's anyway time's up. Okay.
Okay.
Finish. My questions also finished. So, Kiran, you did good. Initially, like
What was the diagnosis? I don't know what
diagnosis
was the
idiopathic
diagnosis.
epilepsy. Diagnosis was simple.
Mhm.
Case was simple. Here,
Uh,
importantly, is like how you take the history.
hmm.
Cases will be
Mhm.
complicated only when you go to UK for the examination.
Mhm.
You examine like Gulf region or India, cases will not be very complicated.
Mhm.
But like this is a common
Yeah,
case, no? Like I think this can come in the exam. Idiopathic
yeah,
epilepsy.
yeah. Even in practice also, I think many
Yeah,
of the
this is a
time we
common
see
problem.
that
Uh,
everything controlled
mm,
and still there is a seizure.
yes, yes, yes. You covered most of the points, like onset, duration, progress, the episode history, and this developmental history, birth history, immunization, nutrition. Maybe because of lack of time, you do not ask much.
But I ask
Yeah, yeah, you
weight
asked
and
weight loss
growth.
screening. Yeah, yeah. Then social history, you asked, family history also. Only few things like you did not ask regarding any vomitings, any history of vomitings. Then seizures, you jerking, you did not ask whether it's only on one part, one side, or both sides are affected. Any tongue injury was there during this episode. Then P you asked, and this like any weakness or any part of the body that you did not ask, like any weakness, and
Mhm.
headache history could have been included. Headache, vomiting, that history was missed. Otherwise,
But this 5-year child, how we will tell there is a headache?
5-year-old child can tell headache. Why not?
Mhm.
5-year-old, no, it's communicative. He can perceive the pain
Mhm.
properly. He can localize also, no. So it can
Mhm.
be like this history can be of intracranial lesion like astrocytome or something like that.
Mhm.
So that was the thing actually. Otherwise, cancers and all other things were good. And tuberculosis is there. You little bit took little more time to think and all.
What is
Overall,
that lesion? It's called periungual fibroma or what?
periangual fibroma.
Ungual. What you said? Periungual.
Hmm. Uh, like management also, you said rightly that I will take neurologist's opinion, but probably requires manage treatment and precautions. Like he should not be allowed to go swimming alone. That could have been added, and always supervised playing has to be there. And shower, you said that cannot go shower. Cycling also, you should not go alone. You should wear the helmet and all. And importantly, they should follow regularly in the OPD if they are started on treatment.
Cycling, he can go alone, but not without helmet. Is it like that, or should
No,
not
actually,
be
when
even?
a very young child, he should be supervised in all things.
Mhm. Okay.
Okay, it was good. Okay, master हो गया तू तो.
Example, 5-year-old child will not drive bicycle. He will tricycle. He will be drive, right? So
Mm.
blindly, we cannot suggest like a helmet or he is without supervision, blah blah. Suppose this is 3-year-old child, so we will not mention cycling and all, right?
Yes.
So we should be careful to give the instructions age appropriate. Like here
Mm.
party and all. We usually we adolescents we give whenever he goes to party, blah blah. So we should be careful. In stress, we can tell like we should not drink alcohol or party, blah blah. Hmm? So that
Mhm.
we should keep in mind age appropriate uh, activities we should tell, right?
Yes, yes.
Mhm. Got it.
Mm-hmm. That rest everything great. Boys, that we have to check this 5 minutes now. That SFC, I am sure simple febrile convulsion we give after 5 minutes, but
Okay.
I'm not sure in epilepsy. And if there is known case of epilepsy
Hmm.
and he is only on medication, then he got, then definitely I think we should give this emergency treatment like midazolam.
Okay.
Hmm?
This is homework.
Hmm?
This is homework for us.
Yeah, yeah.
Okay, let's join again. Huh?
Hmm.